Nurse-patient ratio. Brooke Futral.
Okay, so the QSIM competencies are patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. So when it comes to nurse-patient ratio, the QSIM competency it would fall under is safety. So what's the problem? So the problem with not having enough nurses to patients can put a heavy workload on the nurses. So when that happens, it could lead to quality care is reduced, increased risk for injury, nurse burnout. Nurses can make shortcuts, increase mortality rates, and making the patient feel like they're not important because it's like you're just in there to do a task and you're trying to get it done, and they don't feel like a person, they just feel like a task. Why is this important? So when I thought about this question, I was just thinking, well, what is our goal as a nurse? So our goals as a nurse is to provide the best care we can. And to be able to do that, you don't need to have such a heavy workload. You just need to have an adequate workload, not 7 patients, but more like anywhere from 4 to 6 is normal, but it's also dependent on what department or unit you're in. To be fully present with the patient, so to be able to actually be there for them instead of just going in there, getting your task done, and leaving. Have the knowledge to care for them specifically, so it kind of fits into like the time thing. Like you need to be able to know their disease pattern or their diagnosis and be able to know what to look for, what labs to look at, their medications, and then being healthy as a nurse, so not suffering from nurse burnout or not getting enough water or being hydrated. So in the first article I looked at, it was an observational longitudinal study, and it suggested that growing evidence indicates that improved nurse staffing in acute hospitals is associated with lower mortality. So it's saying having adequate nurses and makes it to where there's not as much people dying. So it specifically looked at the amount of nursing hours per patient days. So the next slide is going to show you a picture from the article that was very interesting. So the green dot, which is the optimal nurse hours per patient a day, is where we're supposed to be at. So this is how many hours you're supposed to be spending with your patient per day. But these little empty dots are what is actually being done. So that was an eye-opener. Next slide. The second article also focused on adequate staffing, and it looked at 14 different studies, and it showed that adequate staffing was associated with fewer hospital-acquired pressure injuries, catheter-associated urinary tract infections, surgical site infections, sepsis, heart failure, and also mortality rate. The third article I looked at was a systematic review and meta-analysis that looked at 35 different articles from different databases. This article found that higher staffing levels were associated with reduced mortality again, medication errors, ulcers, restraint use, infections, and pneumonia. The fourth article I looked at focused on nurse burnout and how to reduce it. So it defined it as a physical, mental, and emotional exhaustion. And burnout not only affects the nurses, but it also can cascade to the patient. So if they feel that you're burnt out, they're gonna pick up on that. So how can we reduce it? We can stop and breathe. As Dr. Link always says, be active. Exercise is always good. Delegate where you can, so you have time to do more critical or essential things. Set boundaries, seek support if you need it, if you feel like you're burnt out, or and also separate work from home. Ways to improve the problem. So what can we do? So a thing that can be done is the need to realize how staff feedback is important. It's important to listen to your staff because they're the ones working the unit and they can see and pick up on things. It's important because they're always there. So it's important to hear what they have to say. Because nurses in the field are leading into solutions to improve staffing. Educate on the importance of nurse burnout, on quality of care, patient safety. Have a communicative scheduler. I just say this on experience. There's been a bunch of times where like you come into work and you're short staffed and they'll be like, oh, the scheduler messed it up, or I requested this day off a long time ago and I'm not supposed to be there. So just really communicating with the person that schedules is good. Offer incentives for coming up on days that you're supposed to have off. And assess for nurse burnout. You can do that by like having like a charge nurse or something, like go around and talk to the other nurses, ask how their day is going, or if they have too much, if they have a lot of discharges, maybe help with a discharge, or if they have a lot of admissions, help with an admission. So my case example is many times I have been to either clinical or preceptor and have seen this problem firsthand. So one particular day I went in, each nurse was receiving 7 patients when they normally have 4 to 6. It created chaos, anxiety, and uncertainty on the floor. The nurses were overwhelmed and the patients were ill either because they haven't seen their nurse yet or they haven't got their medicine yet. The nurses were rushing from room to room, so they weren't really patient focused. They were just kind of doing their task and moving on because that's literally all they had time for. When you do that, errors are more likely to be made and quality patient care was reduced. So in conclusion, having a big workload of like 7 patients or having way too many patients per nurse is a real problem that needs to be addressed because patients deserve to get the quality care and nurses can be the best that they can be. So safety for nurses and patients is key to quality care. And these are my references.